Hi, I'm Dr. Pantalone.
Marcus, how are you?
I'm doing well.
All right.
How are you is the question.
I'm all right. I'm getting there, but I'm here.
Okay. Sounds like you've been through a lot, actually.
Yeah, I've been through a couple things. A couple years ago, I'm actually a carpenter. And about 2 years ago, I was doing some work, and I fell off a ladder.
Oh.
And I got this herniated disc here. So my doctor prescribed some Percocets for me. So I started taking those. After a while, for about 3 months, after about 3 months, I went to refill, and the doctor or whoever prescribes them wouldn't refill them for me. So I started to try to compensate for that, and I started going on the internet and things like that, and getting some opioids, and started going on the street and just trying to, relieve my pain.
Okay, so you started for a good reason, for appropriate reason, and then hit some dead ends when you couldn't get more.
Well, yeah, when I couldn't get the opioids and I couldn't get the stuff off the internet anymore, I just to relieve my pain, I just started to drink a little bit more than I was used to, or than I was before. I mean, during the week, I'll just drink some beers and everything, and during the weekend, I'll drink a little bit more alcohol. I know that.
I'm not interested in labeling you, but I would like to kind of focus our conversation a little bit around both of those things. So let's talk about the drinking. So beer and liquor, they're both alcohol. So 1 can of beer is a standard drink. 1.5 ounces of liquor, like a shot glass, that's the same amount of alcohol as that 12 ounces of beer. So from what I notice, it sounds like, on some occasions you drink until, you're passed out. It's done. Would that be fair to say from the record?
Yeah.
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 Okay.
Yeah.
Yeah, I understand. And that at other times you're drinking, well, tell me, how many beers when you drink? How many beers do you typically have?
If I'm watching a game, I may do a case. Easily can do a case when I'm watching a game with my friends and everything. So that.
Right. So the case is 24 beers.
24 beers,
right.
Yeah.
Okay. And how much liquor on the weekends? How much do you add to that?
In addition to the beer, or just
Yeah.
Oh, wow. I would say I have I could probably drink a good fifth. Good fifth of vodka, maybe.
Right. And then I guess from what I understand, you hit some trouble, maybe a little trouble at home, and
Well, my girlfriend and I, we've been together for about 2 years, and she wants me to get my act together, and she's told me that I act a little bit differently when I'm under the influence and a different person.
You're a different person.
Yeah.
Okay. So that sounds kind of tough, like negative, not the same, nice person that you seem to be right now.
Oh, thanks.
Yeah.
But yeah, I guess
Okay.
you're right.
All right. So there is a direct connection. When you don't have it, and you're wanting it because you've gotten used to having a lot of alcohol, you turn into someone who's perhaps irritable, hard to be around. Would that be fair to say?
All the above,
Okay.
yeah.
Okay. In terms of the treatment, tell me what your thoughts are about the connection between the detox and how things have gone. How did that end up working for you?
Well, I've actually gone to detox with the past year. I tried to go 3 times. Each time was unsuccessful.
You didn't stay through the whole detox, or
No, I
you
didn't.
didn't stay?
I didn't stay through it.
From my perspective, it would make sense to continue trying to seek out treatment that could help with this. But that's just my opinion. It's ultimately up to you what you think and what you feel would be good for you. But not knowing anything more, my recommendation would probably be to look for effective treatment, but perhaps not the detox, since that doesn't seem to be working for you.
Okay.
So what are your thoughts about that?
Well, what are we talking as far as effective treatment?
Well, in terms of the Percocet, having a hard time not being able to get the Percocet and wanting that, sometimes people end up using a lot of alcohol to try to mask the discomfort that you feel when you don't have the Percocet.
Okay.
But actually, you might be going through opiate withdrawal. And so a maintenance treatment is what we call it, a medication that can help you deal with the withdrawal symptoms of Percocet. but also a treatment that could help you gradually reduce your drinking and ultimately get you to abstinence, complete zero drinking. Now again, those are just recommendations that pop out when I talk to a person who's in your situation. Let me ask you, based on what I've just said, how ready might you be to even look into something like that? And let me ask you, on a scale of 1 to 10, so we can try to pinpoint it. 10 means I'm totally ready to do that. 1 means I'm not ready at all.
I'd say right now, maybe about a 6.
A 6. Okay, well that's 60% there. Yeah, you're worried about it being bad, but actually that's quite good.
Okay.
Yeah, and what's also good that I'm hearing is that you're weighing your options. What if I do? What if I don't? But let me ask you to think about one side of that equation. Or just ask you, why did you pick 60%? You could have said 40, you could have said 20, you could have said, no, I don't want to do that. But you didn't.
Well, I think, I recognize that things do need to change. So I'm not, like you said, I'm not completely at a low number, but I know I need to make the steps to make things right. So.
And why is it important for you to make things right?
Well, my girl means everything to me.
Okay, that's one.
So that's the most important thing. And
sure.
I want to get a job as well so we can support our family.
Right.
So that's really where I'm at. I'm just trying to get right.
Right.
On top of me, my girlfriend and I going through some things. My disability check stopped coming in about a year ago as well. So I have been losing money. So I'm trying to get right on all levels.
And that somehow affects money. So tell me a little bit more about that. If you were to go into treatment, how would that affect your financial situation?
Well, I think by going into treatment, it would just be a positive reinforcement for me. Since I think right now I'm taking the first step by even talking to you.
Absolutely.
I think it'd just be positive reinforcement for me to try to get right and just get my life back to where it was.
And as you get right and you get your life back the way it was, might that mean that more employment opportunities?
I hope so.
Would be available? Okay, so there's a financial connection. You didn't pick a lower number because you know that if you get things together with the drinking and the Percocet, your fiance is ready to move forward. And also it sounds like, you don't like the person you become when you're trying to drink as much as you need and find the Percocet that you need. So I think all of those things together really prime you for treatment. And we can talk about the details of what that is, but I think those are all good things that could come to you if you engaged in some treatment.
Okay.
So with all of that, and again, I'm saying that it's up to you what you do next, but let me ask you, what do you think would be the next step, if any?
How long is this going to take? Do I have to go by myself? Can I bring somebody with me? I'm trying to get another job, so I don't really know if this is something that I can do.
You're, like many people, starting to wonder what's going to be involved.
Yeah.
What's it going to take out of me? And maybe you're worried it's going to take away from looking for work, which I know is important to you. Those are all good questions. But ultimately, that's between you and your clinician, the people you work with there, which I think is good because you drive what you do in treatment. It's about you. It's centered around you. And I think these are all good signs that you're motivated and interested in trying to get something done here. But ultimately, that's your call. Some people can do a course of 3 to 6 months. Other people will decide to take up to a year. But to get some benefit from treatment, 3 to 6 months would be a good time to be looking at symptom reduction, meaning withdrawal reduction, lowered cravings. But the best person to talk to about that, and right at the beginning, would be your clinician.
Okay.
But to address the other thing, you don't have to go with your fiance, or you can if you want to.
Yeah, I think I'd want her to go with me.
Okay, that can be very helpful. So, but you see what happens here, as you start to think about what you want in treatment, you get more invested in treatment. And that is the thing that will give you the best benefit, staying really invested in it. So if you have comments or questions or even complaints, I think the best recommendation I would give you is, as you're doing today, bring them up with your clinician.
6 months doesn't seem like that long. I think I'd rather have her come with me as my support system. But, we'll play it by ear and see how it goes.
Good. No, it sounds like you're willing to give it a try, and we'll set you up with a clinician here to figure out the exact place, the date, the time, the address, give you all that information. And I wish you all the best with that.
Well, thanks a lot. Appreciate your time.
Well, I thank you for talking. So I would.
All right.
Good luck with everything.
All right now.
All right.
Take care.